Now, health experts are warning the public not to let their guard down as COVID-19 numbers continue to decline. The World Health Organization recently said conditions are ideal for the emergence of more transmissible and more dangerous variants of the virus. Higher Health CEO Professor Ramneek Ahluwalia says that the threat posed by COVID-19 is still very real. He joins us now via Zoom to discuss this and more. A very worrying notion that has been posed there, that there could be more transmissible and dangerous variants that could arise any time. Professor, maybe just talk us through that, because I think many of us have thought that the worst of the pandemic is now over.
Good evening to you and good evening to everyone. No, thank you very much. I do fully concur with the Director General of the World Health Organization, which when he talks about that saying that the pandemic is over is a dangerous narrative. It's absolutely a dangerous narrative at this stage. We still in the middle of a pandemic. Let me explain certain reasons why it's still very important for us to consider that we are seriously in the middle of still a pandemic that still has surprises for us. And the first of the reason is that this is a mutating virus. And when we talk about a virus which is mutating, it means that this virus loves to enjoy human body, and it keeps moving from one body to the other, not just in South Africa, but all over the world, until it finds a human body of its liking, which is probably the most unvaccinated or unvaccinated body that doesn't give any resistance, or any body with chronic disease that has lower immune system. And what happens is this virus sits down nicely in the human body, binds to a human cell, and starts hiding to a level that starts residing there. And what it does is it starts learning the immune system of our body. And what it starts developing, it starts changing its color, it starts changing its shape. And what it tries to produce was something what we call it as escape mutations. And what these escape mutations are, this virus, because the virus is trying to survive, and the only way it can survive is if it can go unrecognized in our human body so that our immune system doesn't recognize it, and it really enjoys to multiply in bigger numbers, eat from our human cells, and that's how the viral evolution happens. And that is worrying for us, considering that we have known an airborne disease which is very mutating. The second reason is vaccination. When I say only 28% of youth of South Africa, which is predominantly the biggest population, is only vaccinated, which means it's a huge problem. So we have a lot of young lives which are still not vaccinated. When I say only 17% of African community is vaccinated, African population is vaccinated, it gives a lot of room. And similarly, when we talk about the global world in terms of our pandemic or our vaccination rates. So if your vaccination levels are low, which means your immune systems will be low, the virus will enjoy entering your human body, multiplying into more viral loads and hiding and mutating. And that's where the challenge comes. And the third important factor is, do you remember the first coronavirus came to South Africa in March, which was first detected in Wuhan in December? It still remains around and started developing into new mutants, which are its offspring. So we saw a beta variant that caused us a second wave, which is quite havoc. Then we had a Delta that caused us a third wave. Now we had the Omicron, the fourth wave. We also had a huge cases of Alpha that was detected in UK. So what has happened is these variants still remain. These offspring still remain. And they are still somewhere around the world, still mutating. And we knew these were highly virulent variants. The only hope that the world has seen is Omicron, a variant which has lowered its virulence as much as it was highly effective. It had lowered its virulence, and we're hoping that the future variants will always be the ones like Omicron with more lower virulence. But that can never be possible or can be given surety because the other mutations happen. The virus is still trying to develop itself into change in colors when it can escape mutations, and which means it can hide and it can lead into something which we should not want, but can be a possible, which is called highly virulent variants or strains that can affect our country and the global world.
No, absolutely. And as you say that, Prof, it's important to note that there are still deaths globally because of the pandemic, and the vigilance by people is going to be extra important as we as South Africans approach our winter months.
No, you're absolutely right. When we talk about 70,000 lives still dying every week all over the world, we're still in a pandemic, which does affect us. As much as it's taming down, and we pray it tames down, doesn't go to the worst of what I've explained, called the escape mutation, which is highly possible due to the mutating virus. But one thing is for sure, it's a preventable disease. We clearly now understand this virus. 2.5 years down the line, we have grappled to understand the science into this virus, which means it's an airborne. So if you are in a congregate setting, if you are in a closed room, make sure it's properly ventilated. Make sure the windows are open, because ventilation is the perfect key of ensuring you're safe. Masks help, because eventually, if you are in a congregate setting, if you're in an open environment, if you're walking openly, or you are not in a crowded zone, you can walk without a mask. But in a congregate setting, in a closed room where the ventilation is slightly lower, you have to wear a mask, because the mask will help the virus to move from one human to the other far lower than comparatively when you are in open space or in a closed space without the mask. So when we know we have masks, we know we have ventilation. And the biggest preventable measure is vaccine. Now, what the vaccine does is the natural immunity. Yes, 70% of South Africans have got COVID. I'm speaking to people who would have either got COVID during the second wave, a third wave, the first wave, even now on the fourth wave. But what is happening is you are producing natural immunity. But with time, the natural immunity starts falling down. And when you boost it with the vaccine, or you give the vaccine, now the natural immunity only recognizes the particular variant of the virus. But the vaccine helps you understand the virus, coronavirus in general, which means it gives you far more preventive measures against the family of coronavirus. Which means even if the virus enters your body, the virus doesn't know whether you're vaccinated or not. It will enter through the nose, through the eyes, through the mouth. And when it enters and it starts binding with the human cell, starts eating and multiplying, your immune system will immediately act. Your first, second, third, it will kill the virus far earlier. You might get small breakthrough infections, but the vaccine immunity with your natural immunity will hold the camp and not even allow the virus to mutate if it finds your body or anybody suitable for its mutation. So vaccines are eventually the best route. So mask, ventilation, and vaccines. These are the three biggest arsenals of prevention that we have. And if we can start using them specifically in congregations when we meet, in crowded zones, we can open our economy. But when we follow these things, we can save many lives through this.
No, absolutely. And it's quite a note to end it on, Professor. Thank you very much for your time this evening. And I suppose the role of government in ramping up those vaccination programs is going to be very, very important. During the festive period, we had those weekend campaigns that government was running. Perhaps those should return and we should have them more vigorously. Thank you very much for your time, Professor Ramneek Ahluwalia, joining us there to speak about the fact that the pandemic is still here and people still need to protect themselves from the dangers of COVID-19.